Doc Talk with Dr. Paul Conley is copyright 2021, Signer Foundation, and is solely responsible for the content. And now, Doc Talk, brought to you by Plateau Medical Center. Here's Dr. Paul Conley.
Hello, I'm Dr. Paul Conley, and thank you for tuning in to another episode of Doc Talk. Here we are in the Christmas and holiday season. We just wrapped up Thanksgiving. We're right before Christmas and the New Year's holidays. And again, here we are, we're talking about COVID-19. Our numbers are uptrending. Part of this is because we've traveled quite a bit for Thanksgiving. Weather's getting cold. Sports are now indoors. And so we're going to really talk again about where we are, what the numbers are doing in the state of West Virginia, and how we can continue to have the holiday season and be safe. I have a couple guests here tonight that I want to introduce to you. To my left here is Dr. Bruce Greenburg. Dr. Greenburg is a family physician who also spends lots of time in the emergency room setting. He works here at Plateau Medical Center. He also works at other hospitals throughout the state. And so he's going to give us basically what he's seeing currently in the ER setting. And also Dr. Scott Keffer. Dr. Keffer has been on our show many times before. Dr. Keffer is the chief of staff at Plateau Medical Center. He's also our hospitalist, and so he's going to talk a little bit as well about what he is seeing and what's going on, the state of affairs inside of the hospital. So, gentlemen, I appreciate you folks coming here, before Christmas holiday and being able to kind of give us an update. Dr. Greenburg, I want to talk to you, first time on the show. So, we've been talking about vaccines. We've been talking about vaccines now for a year. I received my first dose of the Pfizer vaccine December a year ago. And so it just seems like yesterday that, that happened. And since that time, this virus has mutated. We've seen multiple strains since then. And currently we're right in the midst of Delta, and Omicron is right on the heels. So what is your experience with the vaccine, and what have you seen as far as safety of that?
I had my vaccine too about a year ago in December, and my experience has been overwhelmingly positive. I have some of my patients who are worried about getting the vaccine. They're worried about potential side effects. I haven't had anybody have major side effects from the vaccine. They have some, flu-like type symptoms, for maybe a day or two. But I have had a positive experience, and I recommend it to my patients.
I know, Dr. Keffer, I know you, which we talked about this on one of the shows, and I'm going to bring it up again. As you were anxiously awaiting to be vaccinated, and were willing to get the vaccine, unfortunately, with your exposure and your heroism, working in the hospital, in the ICU, and the PPE, unfortunately, you contracted COVID yourself. Again, that was prior to your eligibility for vaccination. And so with you being someone that's had COVID, maybe you can just, again, briefly tell us, Dr. Greenberg talked about some of the minimal side effects of the vaccine. How was it when you actually had COVID? You're obviously young and healthy. How did that fare? How did you fare with that?
It was no picnic, certainly. I was really excited because of the availability of vaccine. We were going to have our vaccine clinic on December 13th last year, and I was diagnosed with COVID on December 12th, so obviously wasn't eligible that next day to get a vaccine. But I really... there's so much talk about minimal symptoms and healthy people don't get really sick. And I wouldn't say that I was really sick. I didn't have to wind up in the hospital. There were no monoclonals at the time. There was no real significant treatment, but I felt horrible. And I still feel, I think, some effects from it even now. I'm still not totally normal. My taste is still altered. I still have unusual smell changes, and they seem to still fluctuate. So it really wasn't something that I would ever choose to have and wouldn't wish on anyone. I felt terrible during that time, and it's really not completely over.
I think Dr. Keffer, that's I'm really glad you brought that up, because I do think that unfortunately we focus so much on numbers such as number of deaths. And unfortunately, we were talking about this before the show. In this country, we have now surpassed 800,000 Americans. 800,000 Americans have died from COVID-19. And that is just a daunting number for me. And we're having 1,000 deaths per day right now. And so, we're headed to over 1 million Americans are going to die from this. And many of those unnecessary. Now, I know some of these folks, unfortunately, like yourself, you contracted COVID before you were able to get the vaccine, and you're one of the first in line as being a healthcare physician. But I think, we need to think about also folks that get COVID, they recover, but just like you just said, you yourself have a year out. You're still not where you were prior to COVID. And so, again, by all means, you don't want to get COVID if at all possible. And we do have, a vaccine that we do know is safe and effective. Back to you, Dr. Greenburg. We talk about, this infection. We talk about breakthrough, because I do think that, there's some folks out there that they're saying, I see where people have had the vaccine and they still get COVID. And in some ways, I think maybe there was some, again, on the news, I think it was put out there, maybe if you get the vaccine, you'll never get COVID. But we know that's not how vaccines work. We know that people that receive a flu vaccine may still contract the flu. We know that decreases severity and duration. And I think, even with the first strain, the Wuhan, out of Wuhan, China, the studies all showed that it basically 96% of these folks, didn't have serious illness, hospitalization, and death. And so I think that's still what we're seeing. So as far as breakthrough, have you seen some of your patients that have been vaccinated have a breakthrough infection?
Yeah, we had patients in our office, a father and a son. The father had his vaccine, and he still caught it. At the same time, the father was about 80-some years old. The son was in his 40s, had not had the vaccine, and he had it. What was interesting is, this is the same family, same household, and the son spent 4 weeks in the hospital, left with his chest x-ray looking like crud from his COVID pneumonia 4 weeks out after he, had been in the hospital, and was on oxygen, 3 liters, couldn't walk across the room without being short of breath. The dad had it, but it was better in 5 or 6 days, and he had the vaccine. So, but he had a breakthrough infection, and the thing I'm, tell my patients is, yeah, you can catch it. The original quotes for the vaccines were 95% effective. Well, that means 5% of the time, 1 out of 20, you would have a chance of catching it if someone coughed in your face. But if you didn't have the vaccine, I think the chances of you catching it would be more like 1 out of 2 or better that you would catch it. So it's effective, and the idea that it mitigates how severe it is, as shown by this father and son that we took care of up in Summersville.
I think what you're looking for with the vaccine is these neutralizing antibodies. And what that means is if you have neutralizing antibodies, it doesn't mean that you can't catch the disease. And what it means is if you come in contact with the disease, the virus, then these neutralizing antibodies see that rapidly, and they basically are able to, again, the word neutralize the infection. And so that's why it's so important that we encourage folks to receive this vaccine. And I think this will go back to you, because I was looking at some of the things, that you had brought up, before the show. There's been some concern with children. Now we do have vaccination for children ages 5 and up. So basically, if you're 5 and older, you're eligible for a vaccine. And there's been some concern about myocarditis, some other, concerns about children. People will say, well, the kids don't get that sick with it. But the reality is we've had over 100 children between the ages of 5 and 11 that have died from COVID-19. And we've had 2,500 children that had COVID that have this multi-system inflammatory syndrome, and this is inflammation of the kidneys, the heart, the lungs, the internal organs, and unfortunately, this is this long COVID or long haul COVID. So these are children that unfortunately they recovered, but they're not able to participate in sports. They're not able to do things that they were doing before. So when you talk about side effects, myocarditis, and other things with the vaccine, maybe you just touch base on that just a little bit.
Yeah, I talked with Dr. Tom Show. He's a good pediatrician up in Summersville about this issue. And, they report as a possible side effect of the vaccine, very rare, that kid could have myocarditis, probably just from the inflammatory response of the vaccine itself. He has not seen that in the hundreds of patients that he's had. However, he's had a patient who had COVID and got myocarditis from the COVID itself. So, another example of something similar to that is I've had some of my patients say, well, I've heard that if you take the vaccine, you might have a risk of getting a blood clot. Well, again, maybe 1 out of 10,000, 1 out of 100,000 chance of having that kind of side effect. But I've had several of my patients who I've taken care of with COVID who have had blood clots because of the COVID. I haven't had a single patient who's had that side effect from the vaccine of hundreds of my personal patients who have been vaccinated. And so it's a matter of mitigating the risk.
Well, speaking of that, I know, Dr. Keffer, in the hospital, you do, again, the lion's share of all the hospital work here at the hospital. Blood clots, is that something that you see with COVID? Is that something that you treat? Blood thinners? I mean, speaking of blood clots, tell me a little bit about that as far as your hospitalized patients.
Yeah, just the inflammatory process in COVID makes people more likely to have blood clots. So clots in their legs that travel to their lungs that further worsen their respiratory problems. So just that call it thromboembolic risk of COVID is there. So all those people are treated with blood thinners, which are really, have their own risks. So you get sick, and to prevent a problem, we treat you with a medication that is somewhat risky. You're on a completely anticoagulated to prevent blood clots. And just being immobile and being sick, those inflammatory processes and being immobile, that's a couple of the risk factors for clots anyway. So you put yourself at additional risk by taking a medication that's risky that is actually, it's safer than not taking it, but it has its own risk. So there's so many aspects of this, so many levels of risk with this, starting with the risk of vaccination to the risk of contracting COVID to the risk of the medications that we treat you with when you have COVID, just to the risk of being in the hospital. And really the least risk of all of those is taking the vaccine. We've had outbreaks in the nursing homes of vaccinated patients. The first outbreaks that we had like 1 in 5 to 1 in 10 mortality in unvaccinated nursing home patients. Once they're vaccinated and we have an outbreak there, they're not nearly as sick. They are isolated. They are kept away from their families. That part of the treatment is extremely difficult for a vulnerable population. But these old vulnerable people lived at a much higher rate than they did when they had without vaccine. So from 1 in 5 to 1 in 10, we had about a 1 in 50 mortality rate with vaccinated people in an outbreak. So I think that speaks to its efficacy.
It's 10 times as effective. Is what
Correct.
You're saying.
Correct.
And I think, ultimately, I think, I like seeing numbers. I think you can grab a hold of that, much better. You're talking about, again, with myocarditis, blood clots, and we're talking about numbers that were, 12 cases and 10 million doses versus, if you go to, and I'll look this up myself. So if you just go to Google and type in, was the risk of dying in a motor vehicle accident in a lifetime? It's actually 1 in 100. 1 in 100 chance you're going to die in a motor vehicle accident. Far, far greater than the chances of you contracting some side effect, from the vaccine. And even these side effects such as the myocarditis, all of those from what I have reviewed was transient. Unfortunately, not so much if you get COVID.
Correct.
That's not necessarily transient. This is something that you may have something for a lifetime. And so I think that's why it's so important, again, when we talk about that pediatric population, again, because I know what we're seeing, a lot of the transmission in the community right now is that age group as kids have went back to school. But unfortunately, with the holidays, the kids in that age group are also the ones that are getting ready to go visit grandma and grandpa and aunts and uncles at the dinner table at Christmas time. So we're coming up against a commercial break, and so when you guys come back, we're going to talk with our guests a little about monoclonals, the infusion. We're also going to talk a little bit about hospitalizations, and we're going to talk about how the unvaccinated, again, are the ones that are basically filling up our hospital beds. So stay tuned, and we'll be right back. Welcome back to Doc Talk. I'm Dr. Paul Conley. I'm here with my guest, Dr. Bruce Greenburg and Dr. Scott Keffer. Tonight's show is COVID-19, Christmas of 2021, and we've been talking about how to keep you safe for the holiday season. One of the things that we've also been talking about is hospitalizations. If COVID wasn't causing hospitalizations and serious illness, it wouldn't be such a concern. But, as of right now, we currently have 650 West Virginians hospitalized with COVID. Again, when you look at the vast preponderance of this, 82% of these hospitalized patients are unvaccinated. 82%. When you look at the intensive care unit and folks that are on ventilators, that number is even higher. 87% of these folks, are unvaccinated individuals. So again, we know that this is a disease currently of the unvaccinated. But, I think one thing, that we're talking about the break is the fact that, if you're not going to take the vaccine for yourself, you have to really just think about your fellow man, whether that be your neighbor, your mother, your father, a sibling, because what you do has consequences. One thing we're talking about the break is, you're talking about this weekend, Dr. Greenberg, where you had 7 individuals in the emergency room that need to be hospitalized. They need to be admitted. But due to the fact that we have so many COVID patients in the hospital, we couldn't admit them, and they were awaiting transfer. And I know another day this week, Dr. Keffer, we were talking, there was 9 individuals. Now, again, these individuals may have had having a heart attack, right, a stroke, a bowel perforation, and something that because of the hospital surge that we're seeing, they can't get the care they need, or the care they get is being delayed. So again, maybe Dr. Greenberg, and also you, Dr. Keffer, after Dr. Greenberg, maybe you can comment a little bit about the consequences of being unvaccinated.
Yeah, the care in emergency medicine has drastically changed because of COVID. Before, you take care of your patients and you move them to where they need to go and transfer them where they need to go, and usually bed status wasn't that big of a problem. But now a lot of our time is spent trying to find a hospital bed. Just like you said, a week and a half ago, I worked a shift here in the ER. I walked in at 7 in the morning. There were 7 patients that were here in the emergency room. I had 2 beds then of the 9 that you usually have in the ER to try to practice emergency medicine with. The rest of the patients I'm trying to find beds for. And they didn't have COVID. It wasn't COVID that they were being taken care of, but the hospitals throughout West Virginia were filled with COVID patients. So I was sending these patients, I finally got some of them moved out to North Carolina, to Virginia. Why? Because COVID is filling up our hospitals. And that's another thing that motivated me to want to do this Doc Talk, is I was talking about a fear that I have sometimes, is that I'm going to have 2 critically ill patients in a small ER I work at and only have 1 ventilator to deal with it, and having to decide who lives and who doesn't. And when I was looking at the numbers and the spike of COVID cases and the problems, I was thinking that's a real scenario that could happen. And so that motivated me to try to inform our population. Vaccination is safe. We've had 485 million vaccinations that have been given through the country. We know it's safe, it's effective, and I would rather get my patients vaccinated than have to make those bad decisions.
So, Dr. Keffer, another thing we're talking about shortage, not of hospital beds, but, we were talking today at one of our committee meetings about monoclonal antibodies. And again, monoclonal antibodies are highly effective. And if you test positive for COVID, we have talked about this, it rings true. If you're test positive for COVID, please talk about getting monoclonal infusion, vaccinated or not. Okay, don't wait till you're sick. But we're running short of this as well, right? So tell us a bit about the issues with monoclonal antibodies right now.
Yeah, that's kind of been our safety net, and we find every time we think we have a safety net with COVID, we no longer have a safety net. We thought our safety net was going to be vaccination, but we're still below 50% in the state vaccinated. Only 30% of people have had their booster. So we're lagging behind. We're the last in the country, and we started off really strong in our percentages of vaccination. So the monoclonal antibodies have been our secondary safety net, and now we're finding that we can't get those in the numbers of doses that we need. We're limited by a state supply. The state allocates that medication to us, and we really just have to make do with what we're given. We can't find any extra doses. We can't just order it from a company somewhere. So we have enough doses to give about 10 doses a day for a 2-week period. If there's a need above that, we won't be able to administer the medication. So we have people that come in that are sick in their emergency department, and they get monoclonals in the emergency department. We have people that are sick and have an order. We schedule them. We're giving them monoclonal antibodies. But now we're at the point where we're having to cut back and restrict that some and not go just by whoever meets criteria, but we have to kind of tighten that criteria some. So before, we could use the monoclonals for post-exposure prophylaxis to keep people from getting sick, maybe even from contracting COVID. We can't do that right now. We have to wait until you're positive for COVID before we treat. I would urge you, if you do become positive, you do have COVID, you think you're at risk, get tested early. And get treated early. Seek help from your healthcare provider. Come to the emergency department if you're having symptoms. Don't just wait it out. Early in this pandemic, you were just told, well, go home, and if you start dying, come to the hospital. Really, that's all we had. That was really the extent of our ability to treat. Now things are completely different. So don't wait until you can't breathe, or until you're falling down, or until you're coughing so violently that you can't get a breath. Seek some treatment early, and we're doing the best that we can. We're giving everybody everything that we can give them, and waiting until you're on death's doorstep is not the thing you want to do. And we do see that quite a bit. They've waited out because they took guidance that we were giving a year ago, and have continued with that. So if I'm going to tell you anything, it's that you should explore treatment options early. You should be tested early and find out if you're positive. 1, to cut down the chance of spreading to other people, but 2, to get some help. If you're not going to get vaccinated, that's certainly your choice. I'm not going to tell you to do something you don't want to do, but it seems odd that someone who wouldn't want to get vaccinated, who doesn't believe in that for health reasons, would immediately then come and get monoclonal antibodies if they become positive. But we see that quite a bit. So it's kind of like there are no atheists in foxholes. There are no anti-vaxxers who are super sick and then don't want treatment, because that doesn't hold true.
And I think, again, what the monoclonal antibodies do is how they work is they are antibodies that block the replication of this virus, which is exactly what the vaccine does. And the vaccine is your own natural antibodies that are much more durable and they last longer than this infusion. But I mean, we're out here really trying to get people vaccinated because we don't want to be in a situation where, as a healthcare provider, we have limited resources and we have to make a decision on who gets a ventilator and who doesn't, who gets admitted and who doesn't. And so, we're just begging and pleading. But in the same sense, I do think that some people hold off on getting monoclonals because they may be embarrassed. Right. Well, I'm afraid that since I didn't get the vaccine, I don't want anybody knowing that, and so I'm going to hold off before I get monoclonals. please don't do that,
Right.
because monoclonal infusion works best if you give it early.
Correct.
Again, because this is a virus that replicates rapidly, and you don't want that horse out of the barn. So please, again, if you have any symptoms at all, or if you're around contact, the grandkids come in, they just have colds, and the reality is it's not colds, they have COVID, you test positive. Please contact your healthcare provider, get tested.
Yes.
We want to continue to test, and then come in and get the monoclonal antibodies. But again, we're looking at shortages of monoclonals, and so again, the one thing that we don't have a shortage of is vaccine. But right before we finish up the show, because it looks like we're coming up to the end, I want to just briefly talk about boosters real quickly. And it's flu season, folks, so please don't forget about your flu vaccine. And can you receive the flu vaccine and COVID vaccine, whether it be the prime dose or booster at the same time? Go ahead,
Absolutely.
Dr. Greenberg, or Dr. Keffer, whichever.
Yeah, it's perfectly fine. And it's done in every Walgreens, Walmart, CVS, and doctor's office, health department across the country.
Yeah, I told my patients today I had some with that very scenario, and I said, yeah, go ahead. And it's safe, it's effective, and yeah.
Well, I think, the thing is that, as we're getting ready to finish the show, this is Christmas. We want to wish everybody a Merry Christmas here from Doc Talk. We want everyone to be able to get together. We want everyone to be able to have the safest holiday as possible. So, folks, I appreciate you coming on. Dr. Greenberg, Dr. Scott Keffer, my guest here tonight. I'm Dr. Paul Conley. You've been watching Doc Talk. Have a Merry Christmas. Until next time, have a good night.
Doc Talk with Dr. Paul Conley is copyright 2021, Signer Foundation, and is solely responsible for the content.